Yesterday, there was a special parliament sitting to discuss the relief for floods and steps moving forward. Joining me at this time is Crisis Management Analyst NICOLL. Hi, Pete. Thanks for your time. Now, Pete, you say crisis and emergency professionals think of disasters as reoccurring events in four phases: mitigation, preparedness, response, and then recovery. Can you give me an overview of this?
Certainly. Good afternoon, Jessy. As you say, crisis and emergency professionals do think of disasters as recurring events with those four phases: the mitigation, the preparedness, the response and the recovery. These four principal phases are so interlinked that a failure in any one or part of any one has significant repercussions to health, livelihood, social structure, and of course the economy of not only those affected, but of on the last point itself. We have reports that the economy was impacted for the Malaysian government to be somewhere around about 20 million or in excess of 20 billion ringgit, a quite staggering sum. So the key really to start the process is to ensure that you have a strong and reliable command and control structure in place, robust contingency plans, agreed procedures and systems that of course have involved the views of all stakeholders, and that the entire plan itself and the strategy is continually tested as to the effectiveness or to identify any gaps that have occurred. A major change management process review is also a likely requirement here. There has to be a decision on whether this is a pyramid structure, a silo structure, or a defined mixture of both, Jessy.
I hear you, Pete, and of course your line's coming in and out a little bit as we embrace the new norm. I hope that we will have a strong connection here. But Pete, you say that the economic impact to the Malaysian government from the recent floods, for example, is likely to reach, if not exceed, some 20 billion ringgit. Indeed, as you mentioned, a staggering sum. But aside from change management and looking at different structures, could there be a hybrid way or a new approach to this? Basically, what should our conversations at all levels of governance be at this point of time, Pete?
I think, again, the key to this is that what won't help, as we've seen in many post-crisis events around the world, is a knee-jerk reaction. With a lot of people pointing out failures rather than positive steps to remedy the situation. And what we've also experienced is that when you have so many responsible units, often working in silos, there tends to be a very defensive posture adopted when reviews are undertaken. And that's going to be a very tough one for the government to overcome. So I think the conversations need to be very open, very transparent. Pointing fingers at individuals here.
Pete, I'd like to go on to your comment on what the Prime Minister said. Prime Minister in a special sitting just yesterday when he stated that NATMA's absence in the state and the region had caused a lack of coordination amongst agencies on the field, and that there is weaknesses among the relevant agencies regarding their responsibilities at the stages before, during and after a disaster. The Prime Minister also talked about close cooperation between state and local authorities. Now, how should we start thinking about what the Prime Minister has said?
The admission and openness of the Prime Minister's statement itself should be welcomed. And the key point rightly identified by the PM is that there must be closer cooperation between state government and local authorities. But we must remember that when the response really became active, some incredible work was conducted by the emergency services on the ground. There is actual or perceived failings in the early part of any response and recovery. And that's why it's so absolutely critical that the strategic planning has to be thorough, well thought out, and continually tested independently. And of course, there is also the issue in crisis events of the level of media communication, which again has to be coordinated to ensure that a clear and concise level of information is out there for the public. So any failure also has very significant repercussions in terms of political stability. as the public sympathise with those affected, often be very vocal in their criticism of the actual or perceived failures. So the key is a full external review, the way through the system, identifying what's there, what the gaps are, and implementing, a formal protocol for continued testing of the 4 key phases of this disaster management, Jessy.
Pete, how much time would all this coordination and finding key gaps and so on and so forth take? Meaning to say, at what point can we embark on a Plan 2.0 already?
This is not a short-term fix, and as we mentioned, as I mentioned earlier, this is not about pointing and knee-jerk reactions. So a kind of thorough review of this kind can take anything up to 9 months to a year. But what it will do at the end of the day is it will ensure that moving forward that there is, a world-class system in place that works to, international best standards and benchmarks.
Pete, thanks for your time. We'll speak to you soon. That was Peter NICOLL, Crisis Management Analyst. Pete will be on The Nation this week, slightly later this afternoon, in the edition of the News Roundup as we close the week right here on the English Belt. Now, according to WHO, face masks, should be used as part of a comprehensive strategy of measures to suppress transmission and save lives. The more important question now is, do the masks we're spending much money on, especially surgical ones, provide good protection? Nina Muslim, a special writer with BERNAMA, did a piece on this recently. Nina, thanks for joining us. Now, in your latest article that's on bernama.com earlier this week, you say the N95 masks are the gold standard. What is the N95 mask? For us to revisit this, because there's many variants. There's also the KF94 mask. Nina.
Okay, thank you for having me again today, Jessy. In regards to the Omicron variant, which is very, very, very infectious, a lot of experts are encouraging that the public upgrade the masks that they use. Instead of just a surgical mask, they say try using a higher quality mask, which basically filters a lot of the particles in the air, because COVID is airborne. So other versions of the N95 mask is the Chinese standard, which is the KN95, the Korean one, which is KF94, and the European one, which is the FFP2. So and it's the gold standard, basically. The others are similar, but not exactly to that level. But N95 is used by professional healthcare workers and also in the industry.
Well, I remember way back when all of this first started and we had to go out and buy masks. Many were after the N95, as it was also the gold standard then. We've come a long way now. We even see transparent masks, fashionable ones. The question is, SOPs are being relaxed as well at this point of time, as we are learning from the health minister that we will not have to take our temperatures anymore. However, the face mask and My Sejahtera check-ins, those still remain. Now, moving forward, what are important factors to consider when we pick out a mask, or even when we wear a mask? Because, sometimes become a bit of a fashion statement. I see many hanging on the chin and so forth, especially now that we have the emergence of the Omicron variant as well.
Okay. We may be relaxing our SOPs because our vaccination rate is high. However, because of the variant is so infectious, masking is something that we cannot relax on. COVID is airborne, so you need to get at least double mask, which is surgical with cloth, or the high quality mask like the N95 and the rest. Okay. And the most important factors when you're wearing a mask, medical experts told me, is that it has to be the fit. Surgical and you have an N95, a surgical mask that fits well on your face with no gaps, for example, will be better than an N95 or KN95 that is uncomfortable or too loose on your face, so that there's a lot of gaps around your cheeks and your chin or on your nose, for example. So it's not what you wear necessarily, but how you wear it.
That's right. Just to recap, as the connectivity is lagging a little, firstly, pick out the right mask. So we start with N95 being the gold standard, then there are variants as well like the KF94 and so on. But most importantly, it's also how you put it on. It has to be sort of fitting and snug without any gaps anywhere, just to recap at this point of time as well. Now, of course, is there a DIY test to see if the mask meets any bare minimum? Like I said, so many products out there right now, and some may seem quite appealing because they match outfits or they seem more trendy than the other. But is there something that we can do to find out if a mask would meet the bare minimum requirements?
Okay, this is basically Stanford Medical did consultation with the I think it was last year, where they basically set up like minimum mask standards when the public went out to buy masks, and they had this test. One test would be like the flame test, where you put on the mask and you try to blow out a flame. Just make sure that you stay far away from the flame, at least 6 feet away, so that you don't set yourself on fire. And the second one is the sniff test, where you put like an artificial sweetener, and then you try to sniff. If you can smell it, that chemical smell, then it means that your mask is working as intended. The third one would be the light test, where basically you like put up your mask here and then against like a light somewhere, bright light. If you can see the light through your mask, that means the weave is not close enough, it's not filtering any particles that can endanger you, which is why a cloth mask is basically useless. It's just a fashion statement. So if you wear a cloth mask, make sure you wear at least a surgical mask with it, because Omicron is very, very infectious and you don't want to get sick.
Absolutely, Nina. Those are some great pointers. In fact, the sweet test and putting it up against the light, I'm sure that's a test any of us can do at any point of time. So with that in mind, Nina, thank you so much for being with us, and thank you for the article as well. And that was, of course, Nina Muslim, our special writer from BERNAMA Wise. If you'd like to check out the article, please visit bernama.com. It's titled, "Do Surgical Masks Provide Good Protection Against Omicron?" There you go, up on your screen right now. I'm Jessy Chahal. This has been The Brief.